The vagus nerve has several roles, including controlling the muscles responsible for speech and swallowing, and regulating functions as diverse as heart rate, breathing, sweating, digestion, and immunity. A vagal schwannoma is a tumor that grows on the sheath of the vagus nerve. In order to remove the tumor while preserving the vital functions of the vagus nerve, doctors can perform a surgical technique called intracapsular enucleation. The nerve is cut lengthwise and the tumor is removed, leaving most of the nerve bundle and the surrounding sheath intact. With this surgical approach, most patients have full recovery of speech, swallowing, and involuntary vagus nerve functions. A more radical approach involves excising the tumor along with a section of the vagus nerve. This approach, however, paralyzes the muscles controlled by that nerve, affecting the patient's quality of life in a number of ways. The patient's voice is permanently altered, which can have profound effects on his or her socialization. The vocal muscles on the opposing side can become overworked, causing inflammation, coughing, pain, fatigue, and a raspy voice. Muscles of the pharynx and esophagus are also paralyzed. Patients often have difficulty swallowing and breathing, and may aspirate or regurgitate food. A feeding tube is required until medialization of the paralyzed vocal fold and surgical restoration is complete, and the patient has learned to swallow using the working side. Other potential complications include heart palpitations, digestive issues, vitamin deficiencies, and dysfunction in the immune system. The following medical procedures are used to help restore the patient's voice and swallowing abilities. Vocal injections are used to add bulk to the weakened vocal fold. However, this is often a temporary solution for vagal insufficiency, and additional measures are required. A thyroplasty involves using a small implant to push the vocal fold closer to the midline. For patients with complete vagus nerve resection, an arytenoid adduction is often used in conjunction with thyroplasty to close the glottis. These surgical interventions carry a risk of further complications such as inflammation, infection, and the displacement of any implants. For many patients, the numerous persistent complications of vagus nerve resection contrast strongly with more conservative treatments for cervical vagal schwannomas, such as intracapsular enucleation.